welcome back to Park Parent Pointers. This is Bree. This week, this video is very similar to what we talked about last week in regards to when you can resume normal activity. This one is all about our older kiddos. So right after surgery, we recommend a strict bed rest for about 2 to 3 days. And so in regards to that, we want to do minimal walking, kind of taking it easy for a little bit, stay in bed as much as possible for the first 2 to 3 days. After that, you can kind of resume some type of normal activity, but still keeping it super easy for that week or so. So in regards to traveling, it might be best to rent a wheelchair at the airport, see if your hotel has one, because when you're going to different places, whether it's hyperbaric, whether it's restaurants, anywhere, leaving the bed, leaving your hotel room, we want to make sure that you're not walking during that time and you're keeping it super easy. You can go ahead and resume baths and showers after about 5 or 6 days post-op after surgery. You'll have some bandages it's okay if they get wet. Water will run, right off of them, and eventually when they start to loosen up, you can go ahead and remove those at that time. We recommend no coach-directed contact sports, heavy lifting, swimming, all of that for 2 weeks, and then no sexual activity for about 6 weeks after surgery. So I know these are pretty big questions that we get for older kiddos. I know it's a little bit trickier to know what to do, especially whether you're in middle school, high school, kind of that college time. So these are some good facts to keep up with. But if you have specific questions in regards to something specific to you, to your child, or to you, go ahead and give us a call or shoot me an email.